but these are treatable conditions. So don't, like I said, don't give up hope. Just, seek the help that you need. Be an advocate. This is just a lot of data kind of about vaginismus, which of course at some points was considered a hysterical disorder, often was early on related to there must be some marital problems. Maybe there was childhood sexual abuse. Maybe it's just a lack of sex education. And certainly some of those factors can absolutely play a role. But it turns out from studies that have been done and looking at areas of the brain that highlight when individuals with this condition are shown images of penetration, it really comes down to highlighting areas of fear, not disgust, but fear. And it turns out, that, again, that this is more of a phobia disorder that needs to be addressed using some of the techniques that different phobias are treated with. So, treatment, again, multifactorial. There's medications. There's physical therapy with pelvic floor physical therapists. There's the talk therapy, as I mentioned, and then there's always the possibility of doing some forced relaxation of those muscles using trigger point or Botox injections as well. So I do want to make sure I leave time for a conversation with the co-hosts here, but I did always like to end things with a little bit of humor. Sure, avoiding sex or self-medicating, those are acceptable ways to deal with this. But I hope this empowered you, if you're dealing with pain for whatever reason, to know that there can be some answers out there for you, that there can be some treatments. If it's important to you, if you feel distressed because you're not able to have your sexual relationship that you want, if you are in distress because you're not able to complete exams that you need for your preventative health care, please seek help.